all the time. They're going side to side trying to produce the most amount of force to stay in front of their defender. So, another study has looked at ankle brace and has shown that there is no reduced horizontal max force compared to just a normal shoe condition. Also, there's a study that looked at females. They did a squat jump, counter movement jump. So there was also there was no significant max force production within the two taping techniques that they used for their study. So one they used was the heel and lock, and the other was the figure eight taping technique. And then the taping technique that is used by many health professionals today is the stirrup with the heel and lock technique, which I used for my study as one of the conditions. And one researcher stated that there is more research necessary to understand the external ankle support during dynamic activities such as side-to-side shuffling. So, this brings to my questions and hypotheses. How does an initial contact, so when they first touch, and then versus when they push off, how do those compare within my three conditions for my study of research? So my prediction is that the ground reaction forces within the horizontal, this way, and in the vertical direction will be greatest in the tape condition compared to the bracing condition. Also, the other question I'll be looking at is there a gender difference between the relative force values? So I predict that the men will have a greater relative force than women. So for my study, we had 10 sports affiliated participants, 5 male, 5 female, that had volunteered in accordance with the IRB. So for my project, the participants could have any history of lower extremity injuries in the past 2 years. And then, so here's like a little description or depiction of what it looked like. So they would start here at the start of the blue tape. It was measured out to be 3 meters. They would go onto these little gray boxes. These are force plates, which calculate the force when you're moving in the side shuffle. And it calculated, for my research, looked at the horizontal axis and the vertical. So for this movement, it was positive and positive and vertical as well. The three conditions, the normal condition, that's for just wearing regular court shoes and whatnot. And then we also had the ankle tape. So like I said in the literature, the best taping technique was the heel and lock with the stirrup, which is right there. And then this is the brace. This is the Shock Doctor 3-strap brace, which with ankle stabilizers in it. So those little gray force plates that were in the picture, that last picture on the last slide, we had 6 different values that you can get from this graph here. So this was on a BioWare software database that ran the different numbers, and we could calculate or we can produce a graph like this in Excel. So to start, this is the minimum value, which separates the initiation phase and the push phase. So when they first contact on the plate, and then when they push off the plate. So the initiation, that peak right there, is the value that participant produced when they first touched on the plate. And then this little dip right here is just them decelerating, so they're slowing down their motion, and it picks back up as they continue to push off and go in the opposite direction. So this is for both the F of Y, which is the blue, which is the horizontal this way, and then the orange F of Z, which is the vertical going up and down. So for the statistical analysis of my study, we used the ANOVA system to measure the difference across the different conditions. So we looked at the leading left leg and leading right leg for both the no tape and the tape condition. So we also had the post hoc analysis system, which ran those numbers to find the variables within. So based off my results from those graphs and then the statistical analysis, we found that the propulsion peak force in the horizontal had a significant difference. So that ANOVA system produced some values that you can see right here in the group propulsion peak force, that there's a little difference between each condition. So that there's one right there, and then it's a little bit above, so this little significant difference that we can see. However, in the post hoc comparison, there was no difference that we could find within the condition. So then we can also look at the individual with this graph. So this is like one subject, 103. So the orange and the yellow, that shows for the right leading leg, but the first two are just the no tape, and then the second two right there are the tape conditions. So we can look at it both as a group and individual basis. However, we also, based off of the stats and data, there was no significant difference between the initial peak force for the horizontal, and same goes for the initial peak for the vertical, and then lastly for the propulsion peak in the vertical. There was no significant difference across the different conditions. So to sum up basically what I just tried to present to you, the impact force in the horizontal and the vertical, and also the propulsion in the vertical, there was no significant difference between the different conditions, but there was that one difference for the propulsion in the horizontal base. So what that means basically is the tape condition, it has no limited effect on force production for athletes. So this graph basically kind of represents how the values are pretty much in like the same time log. So based off of my study, we have found a slight difference, or a common characteristic within each individual. We can see that some people had a preferred leg, whether it be the right leg or their left leading. And it depends on the individual base. So for you, it might be your left leg, and for me, leading with the right, I may have a higher force value that can be seen from those different graphs and the force values. Also, I looked at an uninjured population. So that is what probably could have caused this lack of difference that you could possibly see. And then it's also, we are still unclear on how the brace condition will affect force production. So this is something I would further investigate, hopefully this next week here. So to wrap it all up, in general, force production was not affected by the tape condition versus the non-taping condition. And as a result, athletes can implement this idea of wearing ankle tape post-rehab or for injury prevention sakes to perform at the same level as they would without any tape or anything at all. So in the future, as I stated, we will be looking at the brace condition and seeing how that has an effect on force production, and if there's any statistical difference within the brace condition versus the taping. So like I stated earlier, I believe that the tape condition will have the most beneficial impact for athletes as they perform cutting movements. And then, so I presented on the different graphs. There was the individual graphs and then also the group graphs. So based off the individual graphs, you can see the exact force values that was calculated and look at it on an individual base. So we can test it on the injured populations to see whether it's beneficial for them to wear tape or the ankle brace. So health professionals, they can implement that in the fact that have their person come in, do the test, and see what is best for them on an individual base. And we can also see how, because there's literature today that states that whether it be ankle brace or the ankle tape, does it have an adverse effect over time? So in the moment, we just looked at it for that moment in time within that condition, but we can see over a few months or maybe possibly years, like how does the ankle tape or brace affect muscle activity over time? So I would like to personally thank all of you for spending your time coming out to watch these wonderful presentations today. My faculty mentor again, Dr. Peterson, and Dr. Alcoya and Dr. Owens for just all they've done for our program and whatnot. Thank you. Any questions?
Things like the individual's height or even the length of their foot play a role in their ability to do
So we also have video analysis of the participants, so we can see. We calculate their height and then their weight as well. So as far as for the weight, we normalize the values for the force, but we can see how they move whether they took longer strides or shorter strides to do the movement. So it could have an effect on. So I think further studies can look and see how, oh, does height play a factor, or just their leg length? Yeah, so I agree that could be possible. Yes.
So I assume, and I don't know if this is a reasonable assumption or not, but I'm assuming athletes are a little bit more familiar and comfortable in how their body moves, and so they know how to land or jump
Right.
more so than someone who isn't athletic like me. So I was wondering if you think that may play a role in why there wasn't a big difference.
Okay.
Because they're not injured, so
Right.
they know what their body can and
Exactly.
can't do. They're looking for, whereas maybe someone who isn't athletic, they won't be as attuned to how their body is moving.
Okay, so to go off of your question, well, the fact that a common person, you're not going to be doing a side shuffle on your head.
You never know, I may be in
I
a
mean-
party mood. Like, after today, I'm on summer break. You never know. Watch out, closing ceremony, people.
Yeah, so that is a tough thing to like put for like a common person. We could run them through the test and see how they perform within it, and see if there's any difference within you or myself, to see if there's any statistical difference that we can portray here.
So what is the big difference between the bracing and the taping? Like what mechanisms are different? Because they looked very, very similar.
Right.
And so what was difference between the two?
So literature has shown that the muscle activity within the ankle brace or the ankle tape has a difference on how you move. So with ankle tape, it's more supported in the fact that it's your whole ankle is taped, right? So you may not be able to move as much laterally because the tape is supporting you from going out that far. Whereas the brace has a little bit of leeway, especially the one that I had. It was more of like a sock. So you had a little more comfortable movement for moving to the side and having your ankle move around or whatnot. I think that's the end of time, but yes.
Thank you so much for
Thank you.
Well done.